Well, thank you, Dr. Patterson. We'll move on now to Dr. Scott Mitchell, who formerly was an emergency room doctor in Guernsey. Dr. Mitchell, please introduce yourself, your qualifications, and make your statement.
Thank you, Senator Johnson. My name's Dr. Scott Mitchell, and I was formerly an emergency department doctor in Guernsey in the Channel Islands. For reasons I'll come to later, I resigned from that post and I'm now working privately. So I'd just like to entitle or discuss my presentation today, What is the Truth, quite simply. Things I'd like to cover are pandemic mortality, particularly covering the mortality as you go down the age ranges. Were the measures taken during the pandemic appropriate and proportional? Discuss the vaccine solution, ability to raise concerns and censorship, particularly affecting my own situation, and particularly related to Guernsey itself, potential signals of harm and excess deaths. So if we consider pandemic mortality from this, what was described as a novel coronavirus, we were getting information. It was quite difficult to get a lot of information, particularly out of China in the early days. But we were told by the WHO that the mortality rate was as high as 3.4%, and the case fatality rate from publications such as this described it as potentially over 4%. But if this was just based on cases presenting to doctors, the case fatality rate, rather than the infection fatality rate, which is all cases, even those with minor symptoms at home. And Ioannidis published later on this in October 2022, finding that the actual overall fatality rate was under 0.1% in those under 69 years of old, and dropped to a very small number, 0.003% in those 19 years old or less. So coming on to the response to the pandemic, I agree the solution was not to do nothing, but pandemic plans seem to be thrown out of the window. It's interesting that this pandemic plan, although geared towards influenza, was drawn up regarding Guernsey at the end of January 2020. Now, as it's influenza, which was expected to be the next pandemic, that there are some differences, but a coronavirus is a respiratory virus and behaves in much the same way. In history, we've seen that some pandemic influenzas have actually been possibly more fatal, such as the Spanish flu of around 100 years ago. So there were no plans for lockdowns, mask mandates, anything in this document. You can find it online and search through it. But I think because of the unknown, public health took a cautious approach and went with these lockdowns till we decided what we were dealing with. However, I was very concerned about possible collateral damage from measures taken, impacts on economics, mental health, for instance, and also delayed access to healthcare, and also things like, in that respect, people with cancer who may not be diagnosed promptly. Was there an alternative? Well, yes, the Great Barrington Declaration, which was announced by 3 professors in October, professors of medicine, October 2020, suggested targeted protection, especially as the majority, the young and the healthy, were very low risk, as I've just discussed before. So the vaccine solution was pushed as the way out of the pandemic. It seemed to be an all eggs in one basket approach. Was it a great gamble? Dr. McCullough, who's on the call tonight, published an article in The Hill in, I think, August 2020, going through this in some detail, saying, yes, this is something that we've never done before, a rapid rollout of a vaccine during a pandemic, and there are risks associated with that. I was also concerned that simple interventions and repurposed drugs were vilified. We published, for instance, on ivermectin in mid-2021, showing a significant reduction in deaths. Other drugs that have been around for many years, as hydroxychloroquine, quite oddly, having fabricated data published in The Lancet as well. But even if you question the data on those, which can remain quite mixed. Other simple things such as vitamin D, we recognized early on there was a correlation between vitamin D deficiency and worse outcomes, especially in hospitalized patients. The initial trials on the vaccines were a very short duration, and was there an overemphasis of efficacy? A relative risk reduction was the headline of around 95%, whereas the absolute risk reduction, because the numbers were actually getting COVID in these trials were relatively small, less than 200 patients out of 40,000 or so patients in the trial. And one of the main concerns with me, although the trials were done very rapidly, some of the aspects of the trial were done simultaneously rather than consecutively. It did mean we did have no medium or long-term safety data. Perhaps you could argue it was a risk for the vulnerable in that sense, but my big question is why they were eventually rolled out to younger people and children. All doctors take an oath, first do no harm. That doesn't mean not doing anything. It sometimes means calculating whether the benefits of an intervention exceed the risk. And with COVID being very low risk to young people, very few, if any, healthy children died from this. We have to question why this was the case. And early on, we knew there were serious short-term risks, such as myocarditis. And again, I have to say, we still don't know the longer-term risks, because these have only been used for a few years. So I protested this and sadly resigned from my position because I disagreed with the government approach in Guernsey. Health professionals should be able to raise concerns without fear of reproach or reprimand. This is actually part of good medical practice, which is the regulators in the UK's advice and kind of code of conduct for doctors. So I was very upset and curious as to why I was sent for investigation by the Guernsey Medical Director for doing so. I raised these concerns in an email late September 2021, and I was sent for investigation for using my work email to raise concerns, speaking to the media without stating it was my own opinion, although I never stated I was speaking officially on behalf of anyone, and potentially violating the Civil Service Code. And to this day, I have not had any response to the concerns I raised. It seemed more a strategy to silence me. As has been mentioned, Fryman and et al. Have analysed the original trial data and found that the risk of a serious adverse event runs at around 1 in 800 people getting these vaccines. So again, might have been worth the gamble in older vulnerable people, but certainly not going down to children and younger people who are low risk. The risk of a serious advent outweighed the risk of COVID to them. So in Guernsey itself, is there a signal of harm? Well, I looked at a few things, including obtaining the registered deaths from the GREF in Guernsey, and this is the last decade of total annual deaths. It's interesting to note that during the peak pandemic year, there were low average deaths, 544. But going ahead after the vaccine rollout, when everyone had been offered the initial dose and possibly a booster of the vaccine, we saw the highest deaths for 2 consecutive years in 2022 and 2023. So if the vaccines are saving people from COVID, then why are there more deaths post the peak pandemic years? Other markers of a problem, there's been a lot of reports in the media recently suggesting the increased use of health services. The hospital has been at peak utilisation, bed utilisation, and cancer surgeries been postponed. The ambulance service has seen recently some of the highest call-outs for a long time, and the A&E department has seen around a 50% increase in attendance in the last few years. Now, some people would say, yes, we're having an aging demographic, people are getting older, and there will be an increasing demand on healthcare. but it seems a rapid increase in the need or utilisation of healthcare services. So I just think these are a potential signal of something going on, a signal of harm possibly. We can't say definitely what it's down to, but I think it should be noted. So my recommendations is certainly an investigation is needed into whether mRNA therapeutics are causing harm, even if it's in a minority. I suggest we need to suspend their use until this is done, because is there really any benefit from giving further boosters? All the data's come from antibody studies in mice, and certainly Cleveland Clinic study suggested that one is more likely to get COVID the more boosters they have had. Is that due to repeated exposure to an antigen causing tolerance to it? We don't really fully understand, even immunologists, the complexity of the immune system. So I think we need to acknowledge those affected and offer help and compensation where appropriate. Thank you for listening.